We're now joined via Zoom by Kgosi Letsiri Phaahla, who's the Chairperson of Contralesa in Limpopo. Kgosi, thank you very much indeed for joining us. Welcome to the program.
Good evening, Peter, and evening to your viewers at home. Thanks for having me.
So the vaccination rollout programs are rolling out. Limpopo, where you are from, seems to have been leading the way, particularly once the registrations began. What do you give that to? Why do you think Limpopo has been in the front in this way?
Thank you. According to the statistics, yes, Limpopo seems to be leading. But if you quantify that in terms of percentages, it might project a very different picture. Because as everybody knows, Limpopo is 80% rural, and most of these people are under traditional leaders. So it was imperative that the Department of Health should have at first consulted with us so that we could assist them in rolling out this vaccine program. But as always, unfortunately, we are thought of as the last resort when times gets tough and when other situations seems not to be going according to their plan. But we are grateful that it is taking off slowly but surely. We are hopeful that it will get there.
What role has traditional leadership played to date? Have you been mobilizing your people on the ground?
We are mobilizing our people, especially when we attend funerals. We always give out the word of our advice and encouragement that people who are eligible to go and get the jab are allowed to do so, and must do so without any fear. Area of registration, because many people that are staying in rural areas don't have the gadgets to do that, or don't even know how to do that in the process. So we are having every moment that we have to encourage our people to go and register and take the jab where possible. And we are of the opinion that if need be, the department should have used our tribal offices as the entry point towards these people that are struggling to reach hospitals and other places where they get their jobs, because we are in contact and having all these people having confidence in us as their leaders. So our word will be taken seriously than listening to the radio or watching television and stuff like that. But we are not proactively engaged as traditional leaders, and that might create the problem in the slow rollout of this vaccine to the people that are in need of that vaccine.
Have the authorities started to be more engaging with traditional leaders?
Come again, Peter?
Have the authorities, the health authorities in particular, because you said that there weren't many conversations that they had with you as traditional leaders. Has that improved as this rollout has started to take place?
I don't want to sound pessimistic, but I don't want to sound pessimistic, Peter. I am the chairperson of Contralesa in Limpopo. I should have been the first entry point for the department to engage traditional leaders through our organization, but that hasn't happened as yet. And it's a worrying factor because the traditional leaders are the people that are connected directly to these people that need this vaccine on the ground. And we should have been the first, in fact, to be consulted in terms of this rollout. Then we would be somewhere in the higher percentage than the 6% that Limpopo is currently now. And with the 37% locations that these people are supposed to get the vaccines from, is a worrying factor, because broad as it is, our province, 37 points are not enough, and they should use traditional cancer's offices to deliver these vaccines that will assist the process quite greatly.
So if I'm hearing you properly, what you're saying is whilst you can reach all the people in Limpopo across the rural areas, the vaccines are not getting there, partly because the authorities are not using the infrastructure that you already have as traditional leaders.
That's correct, Peter. I can give you an example. The current statistics now in Limpopo says only 66% of those that were eligible to register registered for the Japan. That tells a story itself. But if these people were called to tribal offices with the assistance and coordination by the health department, the registration might be over 90% as we speak now, but it is not because the leaders that these people identify themselves with are not part and parcel of the program of vaccinating these people against COVID. So it's a question of why are they not engaging the people that have much influence to the people that are supposed to be registering to get the vaccination, which are the traditional leaders. Let them come to us. We are glad we can assist them in whatever way that we want and they need, and we will definitely get to the point where the province will be satisfied in terms of the numbers that have registered. But as of now, with this current pace that they are going about, it's going to be a mountain to climb in terms of people coming on board, in terms of registering for vaccines and getting vaccinated and stuff like that. We are saying, let them come to us. I'm here, I'm available, I'm representing traditional leaders. I will mobilize them to mobilize their communities so that they can come on board and register and take the vaccine.
Do the health authorities know that you are there and available? Have you engaged with them? Or it is the first time now on television they're watching and they're saying, I must pick up the phone and speak to Kgosi Phaahla?
Peter, I think you know that an organization by the name of Contralesa do exist. And it's not a secret, it's not a under-table organization, is a well-known organization that represents a particular constituency. So the department knows that we do exist. It's just that they have pride in approaching us, and maybe, I don't know what are they afraid of, but we have always made ourselves available to assist our people in whatever way that we think is best that they be served. But no one has approached us, no one has engaged us, and we're surprised because we are the people who are grounded and living among this rural poor that needs this vaccine. So the question of them putting away their pride and approaching Contralesa, and Contralesa convening all the traditional leaders and motivating them to motivate their people to come on board and get vaccinated.
Or perhaps let me ask the question in another way. Has Contralesa approached the health authorities with these solutions?
I personally didn't approach the department as well as my organization, but at my personal level, I wrote an open letter to the department to say, can't you come down to us and let us assist you in the rollout? That I did. You can go and watch my Facebook page. You'll find that I did try something.
Have you had issues in terms of dealing with vaccine hesitancy? Because there's been a lot of fake news that's been floating around and people being giving misinformation. Have you been able to overcome that with the infrastructure that you have as Contralesa?
We should have done that if it wasn't the issue of the level 4 lockdown regulation, because we are forbidden to hold meetings and stuff like that. But that perception is there among our people. But it's not that much because it's among the team that are exposed to this media, social media and all these kind of things. But we are saying to them on a weekly basis that do not listen to this fake news that deter you from taking a responsible decision to get vaccinated and save your lives and save the lives of the people that you live with. It is there. It is natural that things like that do happen in our lives, but the level of accepting it is the fact is very, very low, and to me is not a worrying factor. As long as the department can come down to us, we will be able to quash that thing, that perception once and for all, and get everyone who is available to get vaccinated.
All right. I guess as we start to wrap up this conversation, are you worried that with the slower pace than could be, that we might be losing lives as a result of not mobilizing as quickly as one would have been able to had we used Contralesa's infrastructure?
The situation on the ground, Peter, now is terrible. We used to bury one person maybe in 2 weeks or 3 weeks, but now it's up to 10 a week, which might be attributed to the fact that people don't get exposed to medication or stuff like that, or not even aware that they are infected with the virus. And unless something is speeded up, we're going to continue this trend of losing many people on a weekly basis. But I've learned that the department has asked students from the University of Limpopo to come and assist with the administering of this vaccine, and we welcome that as Contralesa, and we hope that will accelerate the pace of vaccinating our people in rural areas. But what I can give you as a direct response is that there are people that are exposed. There are people that are to be infected because people do not know their status. And unless this is speeded up, I see a disaster coming in some couple of months to come.
All right, and that's where we'll leave it. Thank you very, very much indeed, Kgosi Letsiri Phaahla. Ke a leboga.